Hi, I'm Dr. Altaf, and today I want to talk about something that quietly affects millions of people, and most of them have absolutely no idea it's happening. You might be checking your blood pressure at home or getting it checked at your doctor's office and walking away thinking you have a clear picture of where you stand. But here's the thing, the number on that monitor, it might not be telling you the full truth. Not because the equipment is broken, not because your doctor's team isn't doing their job, but because there are a handful of very specific mistakes, easy ones, common ones, that silently distort your blood pressure readings, often by enough to change the entire clinical picture. And when your blood pressure reading is wrong in either direction, the consequences are real. You might be started on medication you don't actually need, or you might feel falsely reassured when something genuinely does need attention. So today, I'm going to walk you through 10 of the most common mistakes people make when measuring blood pressure, at home and in clinical settings. And I'm going to show you exactly how to fix every single one of them. Let's get into it. Before we get into the mistakes themselves, I want to take just a moment to explain why blood pressure measurement accuracy is worth caring about this deeply. Blood pressure is one of the most important numbers in cardiovascular health. Sustained high blood pressure, what we call hypertension, is a major risk factor for heart attack, stroke, kidney disease, and a range of other serious conditions. And the tricky part is that hypertension very often has no symptoms at all. You can feel completely fine and still have blood pressure that's silently damaging your arteries over time. That's why measurement accuracy matters so much. The decisions we make, whether to adjust lifestyle, whether to monitor more closely, whether to consider medication, all depend on having reliable, consistent numbers to work with. A reading that's 10 or 15 points off isn't just a minor inconvenience. It's potentially the difference between an appropriate clinical response and the wrong one. The good news is that the fixes for almost all of these mistakes are simple. You don't need special equipment or medical training. You just need to know what you're doing and why. So let's start with the one that surprises people the most. Mistake 1, measuring with a full bladder. This one catches people off guard because it seems unrelated. What does your bladder have to do with your blood pressure? Actually, quite a lot. When your bladder is full, it activates your sympathetic nervous system. That's your body's fight or flight system. And when that system kicks in, your heart rate increases and your blood vessels tighten. Both of those things push your blood pressure up. Research has shown that a full bladder can increase your systolic pressure, that's the top number, by anywhere from roughly 4 to 15 millimeters of mercury in typical circumstances, with some studies showing even larger effects in certain individuals. Your diastolic pressure, the bottom number, can shift upward as well. That kind of change is clinically significant. It could easily move a reading from the normal range into the elevated or even high range. The fix is simple. Before you sit down to measure your blood pressure, use the bathroom first. It takes 30 seconds and it genuinely improves the reliability of your reading. Mistake 2, only ever using one arm. Most people pick an arm, usually the non-dominant one, and stick with it every single time. And while consistency matters, there's an important step that many people skip entirely at the beginning. Medical guidelines, including those from the American Heart Association, recommend measuring blood pressure in both arms at your initial assessment. That's because blood pressure isn't always identical between your left and your right arm. A small difference is common and generally not concerning, but a consistently larger difference, particularly a gap of 10 millimeters of mercury or more in your systolic reading, is worth paying attention to. A systematic review published in the British Journal of General Practice found that among people with high blood pressure, around 11% had a difference of 10 millimeters or more between arms. That's not a rare edge case. Why does it matter? Because a consistent, significant difference between arms can sometimes signal an issue with blood flow in the arteries supplying that arm. Things like narrowing of the subclavian or brachial arteries, which a doctor would want to evaluate properly. In practical terms, you don't need to measure both arms every single time, but you should do a dual arm check when you first start monitoring and revisit it periodically or whenever something seems off. If there is a meaningful difference, use the arm that gives the higher reading going forward, and mention that difference to your doctor at your next visit. Mistake 3, sitting in the wrong position. This one is about your body position during the measurement itself, and the data on this is clearer than many people realize. To get an accurate reading, your feet need to be flat on the floor, not crossed, not tucked under you, not propped up. Your back needs to be fully supported by the chair you're sitting in. And this back support piece matters more than most people think. Research has shown that taking a blood pressure reading without proper back support can inflate your systolic reading by anywhere from 5 to 15 millimeters of mercury. That's a substantial error, and it happens all the time in real life. People perching on the edge of a chair, sitting without anything to lean against, or slouching with unsupported posture. The fix is to sit properly in a chair with back support, feet flat on the ground, for the full duration of your measurement. Simple as that. Mistake 4. Positioning the arm incorrectly. Body position matters and arm position matters separately, and the two errors compound each other. A well-designed randomized controlled trial looked specifically at common arm positions used during blood pressure measurement and found that several of the positions people casually use, both at home and in clinical settings, lead to significant overestimation of blood pressure. If your arm rests on your lap during measurement, both your systolic and diastolic readings can be artificially elevated by around 4 millimeters of mercury. If your arm is hanging unsupported at your side, your systolic pressure alone may be overestimated by as many as 7 points. The correct position is this. Your arm should be resting on a flat supported surface, a table or a desk. It should be fully relaxed, not tensed or raised. And critically, the middle of the blood pressure cuff should be roughly at the level of your heart. Most people don't think about heart level alignment at all. But if your arm is significantly lower or higher than your heart during the measurement, the reading will be affected by hydrostatic pressure differences, meaning the reading will be artificially high if the arm is too low, and potentially low if the arm is too high. Take a moment to position yourself properly before you inflate that cuff. It's worth the extra 10 seconds. Mistake 5. Not resting before you measure. Blood pressure is dynamic. It responds to everything: movement, stress, conversation, a brisk walk to the bathroom, even strong emotions. It doesn't immediately return to baseline the moment you sit down. If you've just walked into the room, climbed the stairs, had a tense conversation, or even just been moving around normally, your nervous system is still active and your blood pressure is still elevated from that activity. Measuring immediately in that state gives you a number that reflects your body under mild physiological stress, not your true resting blood pressure. This is one of the most consistent recommendations across cardiovascular guidelines. Before measuring, sit quietly for at least 5 minutes. Back supported, feet flat, not talking, not texting, not watching something stressful on your phone. Just breathing normally and letting your nervous system settle. That 5-minute rest window is not excessive. It's what separates a meaningful measurement from background noise. Mistake 6. Measuring too soon after caffeine or alcohol. Caffeine is a vasoactive substance, meaning it affects your blood vessels. In most people, caffeine causes a temporary increase in blood pressure, typically lasting somewhere between 30 minutes and a few hours, depending on the individual and their caffeine habits. The general guidance is to wait at least 30 minutes after consuming caffeine before measuring your blood pressure. It's worth noting that regular daily coffee drinkers may develop some tolerance to caffeine's blood pressure effects over time, so the impact can vary from person to person. But as a general rule, waiting that half hour is a sensible precaution. Alcohol is a bit more complicated because it has what researchers describe as a biphasic effect on blood pressure. A Cochrane meta-analysis found that moderate to larger amounts of alcohol initially lower blood pressure in the hours immediately after consumption. But then, in the 12 to 24 hours that follow, blood pressure tends to rise above baseline. The magnitude of these effects depends on how much was consumed and individual factors like metabolism. The practical takeaway is this: if you've had alcohol in the past 24 hours, your blood pressure reading may not accurately reflect your true baseline. It could be shifted in either direction depending on timing. It's worth factoring that context in when interpreting your numbers. Mistake 7. Using the wrong cuff size. This is one of the most common sources of error in home blood pressure monitoring, and it's completely fixable once you know about it. Blood pressure cuffs work by applying pressure around your arm until the blood flow through the artery is temporarily interrupted. The monitor then detects the pressure at which flow resumes as it deflates, and that's how it calculates your reading. But for that process to work accurately, the cuff has to fit your arm correctly. If the cuff is too small for your arm circumference, it takes more pressure to compress the artery adequately. That extra pressure inflates the reading artificially, making your blood pressure appear higher than it actually is. If the cuff is too large, the opposite can happen. The reading may come back falsely low, which gives you a false sense of reassurance. Here's how to check your fit. Use a soft tape measure and wrap it around your upper arm, roughly halfway between your shoulder and your elbow. Measure the circumference. The inflatable bladder inside the cuff should ideally cover around 75 to 100% of that arm circumference in length and roughly 40 to 50% of the circumference in width. Most blood pressure monitors come in standard, large, and sometimes extra large sizes. Check the labeling on your cuff, compare it to your arm measurement, and if your current cuff doesn't fit correctly, it's worth investing in the right size. It genuinely changes the accuracy of your readings. One more thing on cuffs. The cuff needs to be placed directly on bare skin. If you have long sleeves, take the sleeve off entirely rather than rolling it up. Rolling up a tight sleeve creates a tourniquet-like compression effect above the cuff, which interferes with blood flow and distorts your reading. Mistake 8. Diagnosing yourself based on a single reading. This is the mistake that probably generates the most unnecessary anxiety and the most false reassurance. Blood pressure is not a fixed number. It fluctuates constantly throughout the day in response to activity, stress, meals, sleep quality, hydration, even your breathing pattern. A single elevated reading does not mean you have hypertension, and a single normal reading does not mean everything is fine. What matters is patterns and averages over time. Clinicians make decisions about blood pressure management based on consistent trends, not individual data points. If you're just starting home blood pressure monitoring, here's a practical protocol worth following. For the first 2 weeks, take readings daily. 2 readings per session, ideally 1 minute apart, to account for natural short-term variability. This gives you a meaningful baseline dataset. If your readings during that period are consistently elevated, that's valuable information to bring to your doctor. If they're consistently normal, that's equally reassuring. But a single number in either direction tells you very little on its own. After that initial baseline period, if there's an ongoing concern about high blood pressure, checking 2 to 3 times per week for the following months is reasonable. If your numbers are consistently normal and you have no significant risk factors, once a week or once every 2 weeks may be sufficient. Your doctor can help you decide the right frequency based on your individual health profile. The key habit to build is this: use your averages to guide your decisions, not any single reading. Keep a log either in a notebook or in an app, and bring that log to your appointments. It gives your doctor a far richer picture than the one reading taken in the office. Mistake 9. Not accounting for white coat hypertension. This one is worth addressing directly because it affects a significant number of people, and it can lead to unnecessary treatment if not recognized. White coat hypertension refers to a pattern where blood pressure is consistently elevated when measured in a clinical setting, a doctor's office, a pharmacy, even a hospital, but normal when measured at home in a relaxed environment. It's thought to occur because the clinical setting itself triggers a mild stress or anxiety response, which temporarily raises blood pressure. Studies estimate that white coat hypertension may be present in somewhere between 15 and 30% of people diagnosed with hypertension based solely on office readings. That's not a small number. This is one of the strongest arguments for home blood pressure monitoring. If your clinic readings are consistently elevated but your home readings are consistently normal, taken correctly, using proper technique, that discrepancy is important clinical information. It's something to discuss explicitly with your doctor, because the appropriate response to white coat hypertension is very different from the appropriate response to sustained, genuine hypertension. Similarly, some people show the reverse pattern: normal readings in the clinic but elevated readings at home. This is sometimes called masked hypertension, and it's equally worth knowing about because it means clinical-only monitoring would miss a real problem entirely. Home monitoring, done correctly, captures your blood pressure in the context of your actual daily life. That's genuinely valuable information. Mistake 10. Using a wrist monitor when an upper arm cuff would work. Wrist blood pressure monitors have become increasingly popular in recent years, largely because they're small, convenient, and easy to use. But there are important accuracy limitations worth understanding before you rely on one. For a wrist monitor to give an accurate reading, 2 things have to be precisely right every single time. The sensor must be positioned directly over the radial artery at the wrist, and the wrist must be held at exactly the level of your heart during the measurement. That sounds simple, but in practice, maintaining that precise positioning consistently, reading after reading, day after day, is genuinely difficult. A population-based study involving over 700 participants found that 86% of subjects had a measurement error of at least 5 millimeters of mercury when using wrist devices, and 63% had an error of 10 millimeters or more. Those are substantial errors with real clinical implications. This doesn't mean wrist monitors are useless for everyone. Some devices have been validated in controlled settings and perform reasonably well when used with meticulous attention to positioning. And for people where an upper arm cuff is genuinely not feasible due to arm size, lymphedema, or other physical limitations, a wrist device may be the only practical option. But for most people, an upper arm cuff monitor is the more reliable choice. Look for one that has been validated by an independent organization. The American Medical Association maintains a list of validated blood pressure monitors that's worth checking. The investment in an accurate, properly fitting upper arm device is one of the most straightforward things you can do to improve the quality of your blood pressure data. I know that felt like a lot of information, so let me bring it together into something you can actually use. Before every blood pressure measurement, empty your bladder, sit quietly for 5 minutes with your back supported and feet flat on the floor, and avoid caffeine for at least 30 minutes beforehand. Position your arm on a flat surface at heart level, with the cuff on bare skin and sized correctly for your arm circumference. Take 2 readings per session, 1 minute apart, and record both. Use the averages of your readings over days and weeks, not individual numbers, to understand where your blood pressure actually stands. If you're just starting out, do a 2-week intensive baseline period with daily readings. After that, adjust your frequency based on your individual risk profile and what you discuss with your doctor. If you notice your home readings are consistently and meaningfully different from what you're told in the clinic, in either direction, bring that pattern up with your doctor specifically. It's genuinely important clinical information. And if you're seeing consistently elevated readings at home, particularly anything above 130/80 on a regular basis, that's worth a conversation with your doctor sooner rather than later. Not because one set of readings means something is definitely wrong, but because it's information that deserves proper evaluation. Blood pressure management doesn't have to be complicated, but it does have to be done correctly. And now you know how. I genuinely believe that informed patients get better care. When you understand what your blood pressure numbers actually mean and how to collect them accurately, you become a far more effective partner in your own health. You ask better questions. You notice meaningful patterns. You avoid unnecessary worry over numbers that were never accurate in the first place. That's what this channel is about. Not fear, not complexity, not shortcuts. Just honest, evidence-based information that you can actually use. If you found this helpful, I'd love for you to subscribe to the Dr. Althoff channel. Every week I put out videos like this one. Clear, accurate, genuinely useful health education for people who want to take their well-being seriously without being overwhelmed by jargon or misinformation. And if you have questions about blood pressure management, lifestyle interventions, or anything else covered here today, drop them in the comments. I read them, and your questions shape future videos. Take care of yourself. I'll see you in the next one.